My name is Lelia Thornton. I'm a public health specialist and I work in the Health Protection Surveillance Centre of the HSE. That's the National Centre for Overseeing Infectious Diseases in Ireland. My main area of work is hepatitis, particularly hepatitis B and hepatitis C. We recently did a study on hepatitis C in Ireland, and what we wanted to do was try to figure out how many people are living in Ireland with hepatitis C infection. This hadn't been previously done. Nobody really had a figure for the number of people who are there with ongoing infection, and this kind of information is needed to plan prevention and treatment services. So what we did was we used a number of different sources of information, from laboratory information and notification of infectious diseases. We used information from different sources and put it together to try and give us a count of the number of people who've been diagnosed with hepatitis C in Ireland. And then what we had to do was make some changes to the figures, because obviously some people over the years would have died and other people would have actually cleared the infection, and what we wanted really was to establish the number of people who are still alive and have ongoing infection. The other thing that we had to do then was to take account of the number of people out there in the community who might have hepatitis C infection but have never been diagnosed, and we know that that can be quite a lot of people. Now, that's not information that we have in the Irish population, but we were able to adjust our figures using information from England and Scotland, where they have done studies to try to find out how many people are undiagnosed. So what we have found out is that putting together information from all these sources and then adjusting it to for the number of people who are undiagnosed in Ireland, we have estimated that there are at least 20,000 people in Ireland with hepatitis C infection, living with hepatitis C infection, and the figure actually may be as high as 50,000, depending on how many people are undiagnosed so far. So at least 20,000 people in Ireland, we estimate, have hepatitis C infection. Of the people who have hepatitis C infection in Ireland, about 75 to 80% are people who acquired it through injecting drug use. In terms of the age and sex breakdown, of the people who got it through injecting drug use, about 2/3 are males and 1/3 female, and the average age at being diagnosed with hepatitis C infection for these people is 23 to 25 years. So this study has given us very good information that will be useful for planning services, prevention and treatment services. But there are still some gaps in our knowledge, and we would like to do some more research. For example, it's important to know how long people have been infected. So we might know how many people are out there with infection, but to know how long they've been infected is very important, because we know with hepatitis C infection it may be 20 or 30 years before people develop serious effects from it. The other thing that we would like to know is a bit more about the level of undiagnosis in the population, how many people in the population have infection and are not yet diagnosed, and that would need specific studies as well. So we would hope to be able to do more work in this area in the future.